Hi, everybody. Welcome. We have a lot of attendees today, so we're going to just take a couple seconds here to let people filter in. We're very excited to have you all here today. All right, why don't we get started? We're starting to come to a large mass of folks. Hi, everybody. My name is Sam Brooks. I am the Director of Public Policy at the National Consumer Voice for Quality Long-Term Care. We're very excited to have you all here today for our webinar, Hidden Profits in the Nursing Home Industry. We've been excited about this webinar for weeks, and we're really excited to have you folks here to be able to listen to this really important information. Next slide, please. For folks who don't know us, and hopefully you do, the Consumer Voice is the leading national voice representing consumers and issues related to long-term care. We advocate for public policies that make care better for recipients of long-term supports and services. We empower and educate consumers and families with knowledge and tools they need to advocate for themselves. We train and support individuals and groups that empower and advocate for consumers, and we promote the critical work of of direct care workers and best practices in quality care delivery. Next slide, please. Just some housekeeping things. This program is being recorded. If you have any questions for um, the speakers, please put it in the Q&A, which is at the bottom of your screen. You can use the chat features to talk amongst yourselves, but to ask a question, and hopefully we'll be able to get to them, please put it in the Q&A. And links to these resources, please complete the evaluation questionnaire when the webinar is over. And all of this will be posted on our website, including a recording of this and the slides. So you'll all be able to get that after the webinar. Next slide, please. So we're here to talk about related parties. If anyone knows Consumer Voice and knows me, I could talk about related parties forever. I suspect I'm probably in a discrete group that enjoys that. But we wanted to I wanted to introduce the idea before we got to Drs. Olenski and Gandhi about their really important paper. On the screen is a resource that you can download and read, and it's all about related parties and CMS's role in regulating them. What a related party is, when we're talking about related party and related party transactions, are companies that do business with a nursing home and are related to the nursing home through common ownership or control. In other words, I own a nursing home. I have a company that does laundry services or management services. Those companies charge my nursing home, and we do business together. This was originally conceived about 20 years ago to protect, as an idea to protect nursing homes from liability for poor care. The idea you separate the assets from the practice, from the company, and they're protected. But quickly, I think folks in the industry figured out that they also can be used to disguise how profits are taken, and that's why we're here today. And they also make nursing homes look less profitable. Related party transactions are debits. They are expenses on cost reports. However, there are expenses paid to the people paying the bills. So it's a circuitous type of transaction. And cost reports, critically, cost reports now as CMS has them, as the Center for Medicare and Medicaid Services has them, just don't capture enough information. And I think you'll see that today from Drs. Olenski and Dr. Gandhi. Please, next slide. Also here, and I don't want to spend too much time on that, we issued a report, Where Did the Billions of Dollars Go, last year. Please go and read it. It's all about related parties and showing how they're used. Next slide, please. And this is what we got to. I'm really excited. I couldn't sleep last night. I was so excited that this was going to happen today. We're joined today by Dr. Ashvin Gandhi and Dr. Andrew Olenski. Dr. Gandhi has his PhD in economics. He's an assistant professor at UCLA Anderson School of Management and a faculty research fellow of healthcare and aging at the National Bureau of Economics Research. Prior, he worked at a variety of important features in the nursing home industry, from identifying admissions discrimination to measuring the alarmingly high turnover rates in the industry, and very importantly, one of my favorites, studying the disastrous impact of private equity on nursing homes, private equity ownership. And then Professor Olenski is an assistant professor in the Department of Economics at Lehigh University. He earned his PhD in economics at Columbia University, specializing in healthcare and industrial organization. His prior studies on physician and hospital behavior have been widely published in outlets such as the New England Journal of Medicine. Dr. Olenski's recent work has focused on the impact of nursing home closures on residents, developing novel measures of nursing home quality, and studying the efficacy of state-led efforts to raise nursing home staffing. So next slide. And I turn it over to you. We're really grateful to have you here, and turn it over to you, Drs. Olenski and Dr. Gandhi.
Thank you so much for that lovely introduction. And hello, everyone. I'm Ashvin Gandhi. I'm very excited to tell you about the work that Andrew and I have been doing on tunneling and hidden profits in healthcare. As a little bit of a heads up, this is going to be a little bit of an academic talk because this is an academic paper. But we'll try to sort of make things as clear as possible. If you have questions, again, please feel free to drop them in the Q&A box. And either Andrew or I will be not speaking, and we'll try to respond to clarify anything that's unclear for you. So we've already been introduced. I'll just add one thing here, which is that Andrew and I are both economists. I'm a professor at a business school. I know that many of you are advocates and that we're really excited to be here speaking with you. We don't really think of ourselves as being advocates in the sense of we're not really anti-corporation necessarily. I think hopefully that lends a little bit of credibility to some of our findings here that about these hidden profits in the industry, because we're really came at this from the big question being, how can this industry be claiming to be so wildly unprofitable, where the typical nursing home is claiming to earn essentially zero profits each year, but you don't have nearly as many closures as you would expect in an industry where essentially all firms are claiming to be unprofitable. And so, we came at it with our sort of lens as economists to try to understand what's going on. And as we dug and dug and dug, we eventually ended up finding that, hey, it looks like there's some funny accounting going on here. And hopefully we can bring some attention to this and really leverage some of the statistical tools and methods that economists have to try and speak to this. So just as a little bit of a refresher for everyone on what a related party transaction is and how it can be used to hide profits. Here, imagine we have a nursing home in this diagram. Now, that nursing home may transact with other companies, say a property company or management company. And that transaction involves the nursing home paying money in return for goods and services. So say, for example, a nursing home is renting its land and buildings from another company, then it pays rent, and in return, it gets to use those land and buildings. Now, if that other company has no relationship to the nursing home is going to negotiate or insist on some sort of fair price. It's going to try to get a good deal for those goods and services. Now, what we're going to think about is what happens when, then the nursing home then, it pays some payments for those goods and services. It has some profit margin it ends up making, and it pays that to its own owner. Now, what we're going to be thinking about today is what happens if that property company, that management company, whatever other company the nursing home is buying goods or services from, is actually under the same corporate ownership as the nursing home. In those cases, that management company, property company, et cetera, is also paying its profits to the corporate ownership. And those profits are hidden profits. They may not be visible to the regulator or the government who's interested in trying to understand how profitable the nursing home is. They may not be visible to a malpractice claimant who's trying to sue the nursing home for poor quality care. And in particular, what we might be really concerned about is that recognizing that they have this hidden profits and the visible profits to the government, which are the ones the nursing home pays directly to the owner, the nursing home may inflate how much they pay that related party for a particular good or service. So you might pay rent above what the fair market rent would have been in order to remove profits, so shrink these visible profits on the books of the nursing homes, and juice the profits on the side of the related party, because those profits are not going to be easily visible to the government. They're not going to be easily visible to the public, and they're not subject to the same scrutiny by regulators or by malpractice claimants. So the key question here is really going to come down to, how do we think about what the fair price, the fair payment would be in these cases of related party transactions? And that way we can understand whether we're in a scenario where those payments are being inflated in order to hide profits, or if we are in that scenario, how much are those payments being inflated to hide profits? And there are a few approaches to try to think about this and get at that number. One approach is to use the costs that are reported by the related party about how much it costs them to provide that service. So if you're renting from a related party or you're using a related party management company, the idea here is you ask that related party to file some sort of financial statement indicating how much they spent on all of their costs to provide that good or service. Now, this is actually really nice in theory, because it basically says, hey, we're going to implicitly assume that the fair price here would have been whatever the related party paid on their financial balance sheet to provide that good or service. The challenge is that it requires you to get really good, honest, accurate financial reports from the related party. And we might be particularly skeptical that the related party is going to provide really, really good, accurate reporting on their costs. And the related party is not putting their thumb on the scale and inflating how much their costs look like, especially given that the related party is so many steps removed from the Medicaid or Medicare regulators, that's where they might be particularly inclined to kind of inflate those costs. On the other end of the extreme, you might instead assume that all related party payments are tunneling. That basically the related parties have no real costs, and it's all just payments that are hiding profits. We think that this might also potentially be a little bit unfair, but in the other direction. Because the related party, if, for example, it's the landlord, probably does have some real costs, like mortgage, like the cost of a mortgage or taxes or interest. Now, this still might be a desirable thing to do if your goal is simply to stop the use of these related parties, because it takes away any accounting advantage to using them, and in fact makes it potentially unfavorable from an accounting perspective. The approach that we're going to use is the following. We're going to try to look at cases where a nursing home wasn't using a related party, say they owned their own land and buildings, and then we see them suddenly switch to using a related party. In the case of land and buildings, it would be they sell their land and buildings to a related party that's under the same corporate owner, a real estate company that is also owned by the same corporate owner, and then they rent from that real estate company. And we're going to look at how the cost that the nursing home is paying changes as they make this transition from owning the land and buildings to renting essentially from themselves. This approach is really great from a statistics perspective, but bad from a policy implementation perspective, because we really are going to focus in on these specific set of cases where we can see those transitions. And we're going to kind of ignore these cases where maybe the nursing home has been using a related party since 2000. And in those cases, those are still important for the regulator to understand, but they're not going to be what we use to try to scale how much profit is being hidden. So I want to be clear up front that this is a research study, and I want to be clear with you what you have to believe in order to kind of believe that our estimates are true. And the key assumption for our approach is going to be that the true costs of these goods and services didn't meaningfully change right as the facility switched from not using a related party to using a related party. So the way to think about this is that when a nursing home goes from owning its own land and buildings to renting the same land and buildings from a real estate company that is also under the same ownership, that the land and buildings haven't themselves changed. And that the sort of true cost of that land and buildings hasn't changed. And if you believe that's generally true, then I think our statistical methods are going to do a good job of dealing with all the other concerns you might have, and let us get at essentially what is the average amount of profit that is hidden through each of these related party transactions. So with all that being said, I'm going to now hand this over to Andrew, who is going to talk a little bit about our setting and some of our estimates for the size of these related party hidden profits in a couple of different contexts. So I'll let you take it away, Andrew.
Sure. All right. Well, great to be here. So of course, as Ashvin said, we're looking at related party transactions. And something I want to point out before we get started is that related party transactions are actually pretty common across the healthcare sector. So we're looking specifically in the nursing home industry, where depending on how you measure, somewhere between 75 and 80% of firms engage in some sort of meaningful related party transactions. But nursing homes are not alone in this, right? And renal dialysis in particular, you see close to 100% of firms engage in some sort of related party transactions. But of course, we are looking in nursing homes, and in particular, we're going to be studying data from the state of Illinois. And the reason why is that Illinois has provided really high quality data on related party transactions going back to about the year 2000. So as far as we can tell, the state really has the best reporting requirements of any state going back the longest period of time, which is really helpful for our study for reasons that I'll get to in a few minutes. Or actually, I'll get to it here. So crucially, right, as Ashvin said, what we're going to be relying on is the changes in a nursing home's reported costs around the time of a related party adoption. And so what is really helpful for us is recognizing, well, hey, actually related party adoption has grown pretty considerably over the last 2 decades or so. We're starting in the year 2000, about 55–60% of firms engaged in any sort of related party transaction. And as of today, that number is close to 75 to 80%. So this very large number of switchers is going to be very helpful for us. The second thing that's worth noting here is that we've really seen rapid growth in 2 areas, management and real estate. So we're going to focus our real attention on these two types of related party. If you look at the costs, what you see is that this is the lion's share of all spending, right? About 75% of related party transactions go to one of these 2 services. So for the rest of this talk and for most of our research, we're going to just focus on what happens when a facility adopts a real estate or a management related party. And specifically, right, we're going to start with thinking about real estate, because here I think the case is very clear. So as Ashvin said, what we're going to be thinking about is if you're a nursing home who owns your land and building, and then one year you sell that land and building to a sister company that shares common ownership with you, how do your total costs change? So what we have right in this graph it's a little technical, but I'm going to walk through it. For ease, I would say let's just focus on this right region here, which will show us how a facility's spending changes after they sell their building to a real estate company. So after you sell your building, all right, what's going to happen? Well, you're going to stop paying your mortgage. You're going to stop paying your taxes. All right, you no longer own the building, so you're no longer required to make these direct ownership expenses. And of course, that's what we see, right? We see that on average, a facility after they sell their building, their direct spending on real estate falls by about $4,000 per bed. Right, that is of course to be expected. But at the same time, once you start renting from a related party, your rental payments go up as one would expect, and your rental payments go up by about $4,000 per bed. So you're saving $3,000 on the direct costs of real estate, but now you're paying $4,000 in rent all per bed. And that difference, that $1,000 difference between the 4,000 and the 3,000, that is the hidden profit here, right? That is the amount, that's the total amount that you're paying more for any sort of real estate than you would have been in the absence of a related party adoption. This gap is the hidden profit, right? That's the inflated profit, the inflated payment that reflects the hidden profit that Ashvin talked about earlier. Now, is this necessarily a problem, right? Is this necessarily a sign that something's going astray? And the answer is not necessarily, right? There could be a perfectly reasonable explanation for this, and that explanation is that one reason why a firm would want to engage in this sort of transaction where you sell your building to another company and then you start paying rent is to inject cash to the nursing home's balance sheet, right? If you're really cash strapped and you need some liquidity, one thing you might want to do is sell your building and then start renting it. But we don't see that. That is definitely not what we're finding in our data. Here, what we look at is the total number of assets held by the nursing home per bed. And what you see is that what you would expect if this is a perfectly fair transaction is that the total assets held by the nursing home should stay flat, right? There should be no change in the total assets held by a facility after they sell their building, right? If I own a nursing home and if I own the building and it's valued at $1 million and I sell to a related party and now I have $1 million in cash, right? There's no change in my net assets, right? I used to have an expensive illiquid asset. Now I have a lot of cash. But instead, what we're seeing is that the assets held by the nursing home actually fall pretty considerably. So they fall by about $50,000 per bed on average after a transaction. So with an average bed size of about 100, that's about a $5 million drop in total assets held by the facility, right? So that's a pretty significant decline in assets held by the nursing home. And you might think, oh, well, if I'm using this cash to pay off my mortgage, then this all works out just fine, right? If the facility owes a big mortgage that they're able to get off their books with the big cash infusion from a related party, then there's not an issue here. But we're also not seeing that, right? So we can also separately investigate the long-term liabilities held by the nursing home. And what we see is that, predictably, as you would expect in these black triangles, the liabilities do fall after a transaction. They fall by about $20,000 per bed. So the facility is losing about $50,000 in assets per bed, and they're gaining only $20,000 in liabilities off their balance sheet, right? So that gives us a $30,000 per bed. That gives us $30,000 per bed that just seems to evaporate off of the firm's balance sheet entirely. And indeed, this leads to the kind of surprising result, we think, that the book equity, right, the total assets minus the total liabilities held by a facility actually becomes negative for a lot of nursing homes, right? Meaning that the total assets held by a nursing home far exceed the total liabilities held by a nursing home far exceed the total assets held by that same nursing home. This is very hard to rationalize I think this is very hard to rationalize as anything that could be good for the facility, right? The facility is losing assets. They're getting some liabilities off their books, but not as much as they're losing in assets. They're now paying a higher rent. They're paying a higher rent than they were paying previously in terms of their total real estate spending. And so you're kind of asked, you're kind of left wondering, why would a firm do this, right? What benefit is there to the nursing home entity from engaging in this sort of transaction? And so we look at this and think this is very hard to rationalize from an economic standpoint as anything other than just an accounting trick that shifts the money off of the nursing home's balance sheet and onto the related party. We can do something very similar for management services, right? So I mentioned earlier that the two areas we really focus on are real estate and management. And here we find very similar results. So after a facility adopts a management company where, a management company oftentimes is just the owner of the nursing home that has set up a separate firm to provide management services to the one facility that they own. So oftentimes we see no actual changes in the management team or the quantity of management services, or however we want to think about it. And what we find is that the direct spending by the facilities on management falls, as you would expect, right? I'm no longer paying a manager, so I'm going to spend less on management. But now I'm paying a related party for management services. I'm paying a related party much more for management than I myself was paying previously. And so this difference, right? Once again, this difference of about $1,000 between how much I would have spent and how much I'm now spending, this reflects the inflated payment, right? The inflated payment above the sort of fair market price that we think is being used to hide profits off of the firm's books. And with that, I'll hand it back to Ashvin to talk about what we can do with these results.
Right, thanks, Andrew. I want to just quickly answer for everyone a question that came up a handful of times in the Q&A, and I think Andrew will take over the Q&A a bit while I finish up. But there was sort of a repeated question that we were getting about how one can figure out whether or not a nursing home is using related parties for various different services. Now, the answer here is that in theory, you should be able to look at the Medicare cost reports, and in particular, look at the related party transactions in the Medicare cost reports in order to identify whether or not a particular facility is using related parties for different services. Now, the challenges of the Medicare cost report data tends to be of relatively low quality, and the required level of detail is unfortunately extremely low. That's a big part of the reason that we really focus in on Illinois in our particular study. Illinois requires much more detailed data from related parties, and it requires that every related party cost link up directly with something on the balance sheet that a nursing home would typically have to report. Or the cost report that the nursing home would typically have to report. Now, my recommendation would be that if you're interested in trying to identify whether a particular nursing home is doing so, is first look to your state cost reports, the Medicaid cost reports, because some states are doing a better job of tracking those than the federal government. Illinois, for example, recently California started collecting data on this, a handful of other states as well. And if it's not there, then you can always look to the federal cost reports, again, with the caveat that the quality may not be great. Okay, so back to the slides. So if we want to sort of put these results that Andrew showed us in context, one of the things we did is we applied that same type of methodology to a bunch of different areas where nursing homes could be using related parties to estimate how much profit is being hidden in each of these areas. And then we can add that all up to say how much profit is the typical nursing home hiding through related party transactions. And what we find is that for the typical nursing home using related party transactions, they're hiding about $300,000 of profits each year on average, with a large degree of variation across facilities in exactly how much is being hidden. Now, across the whole industry, including nursing homes that aren't using related parties, what this ends up meaning is that almost 2/3 of all profits are being hidden through related party transactions. About $230,000 on average across the industry, including nursing homes that don't even use related parties. So to put that number into context, it's worth asking, how much money is that? And I'm not sure why we're jumping around, but it's worth asking how much money is that? And one way to answer that question is to think about how much additional care could have been purchased using that money. So, for example, that additional profit could have, on average, been used to purchase an additional 15 minutes or so per patient day of registered nurse care at the typical nursing home using related party transactions. So 15 minutes a day of RN care doesn't sound like much, but in actuality, it's actually quite a lot. At a typical fairly good facility, you might get a half an hour of RN care per patient day. And so you could really substantively improve quality of care from RNs if this money happened to have been spent on RN care instead of having been hidden profits. Likewise, you could do the same exercise with CNA care, and you'd get almost a half an hour of additional nursing assistant time per patient day at the average facility if those related party profits were instead having actually been spent towards hiring additional staff. Now, I want to be clear that we're not trying to be prescriptive here. Of course, firms do need to earn some returns, but I think this gives some valuable scale for how much the money is that is being hidden, how important it is in terms of the opportunity cost of what could potentially be done to improve care. Now, I want to conclude by giving you some of the high-level takeaways from our study. The main research finding here is that there are a lot of hidden profits on the order of $300,000 per facility using related party transactions. Now, if anything, we actually think we might be underestimating this number, believe it or not, because where we're looking is where the light is shining, which is in a particular state that requires fairly good reporting on these transactions. The problem actually may be worse in other states where this issue might be even more hidden, and therefore facilities may be even more able to utilize related party transactions to hide profits. If you want to think about this in terms of what are the sort of policy, regulatory, advocacy takeaways here, we'd say the big one is we need much, much better data. One way to get at that is to audit cost reports. Now, CMS and people on the Hill we've talked to are extremely resistant to the idea of doing any auditing of Medicare cost reports, with the understandable concern that that could be very resource intensive to do. But we want to really point out and emphasize that auditing can be really effective, even if it's really rare, right? We're all probably going to file our taxes in the next 5 days. And most of us are going to be pretty darn honest in what we report, even though the IRS only audits a really, really, really tiny percentage of people. And so rare but focused audits on high-risk areas like related party real estate, related party management, the areas where we see most of the action going on, could be relatively feasible in terms of cost for CMS to implement, but could have huge gains in terms of improving the quality and transparency of reporting. We could also ask that there be better and more complete reporting required of related parties. For example, we could ask that everything a related party reports be directly able to be lined up with the same cost centers being used by nursing homes. And we could require that related parties also report their full balance sheets. I'm not sure what, unfortunately, we have all 5 of us have access to move slides. And so we have ghosts taking control every once in a while. So we could require them to file their whole balance sheets. As we saw, and as Andrew showed us, it ends up being that that one of the ways in which assets can basically be hidden is through transactions like sale leasebacks. And being able to see assets and liabilities, payments to shareholders, et cetera, would allow a much, much more complete picture of what is happening with these related parties. And then lastly, if we know that there are particularly large and impactful transactions that we should be really wary of, things like a related party sale leaseback, where you're selling your land and buildings to a related party real estate company and renting back from that, those are relatively rare events that have really high impact on the book value of the nursing home. Maybe in those particular cases, we should have some sort of particular specific review and approval process to understand and ensure that that is happening at some sort of fair market value. So with all of that being said, I'm really excited to open things back up for Sam to jump in and ask us questions, and hopefully open up the discussion with all of you. Thank you so much. We really enjoyed presenting this.
Thank you, Dr. Olenski, and thank you, Dr. Gandhi. You certainly sparked off a lot of discussion, both in the chat and the Q&A. I just wanted to point out one thing before we got to questions, is really putting a number on direct care really highlights how much the use of related parties influences the policies that CMS makes. Many of you know that CMS just proposed recently a staffing rule, a rule that we felt was certainly inadequate and low. But a lot of the justification for it is that there's not enough money. And when we see these really billions of dollars floating through related parties, it's very frustrating to get that type of response that Dr. Gandhi was just talking about, that we don't want to audit cost reports. And as a result, a lot of states are going around the federal government now and doing it themselves. But that is not the answer. It's inequitable to residents. Residents living in Illinois shouldn't be entitled to better care than residents in other states. So I just wanted to put this also in perspective, how this degrades and influences other policies that should be designed to protect residents. And I'll get off my soapbox there. And that is in no way associated with Dr. Olenski and Dr. Gandhi. I wanted to go back a little bit. So obviously they have good information in Illinois, and that very well, as you said, could result in more honest disclosure. Can you talk a little bit about the federal cost reports? You touched on them a little bit. What information is provided by related parties on a federal cost report? And for folks that don't know, each year nursing homes are required to file a Medicare cost report with detailed information on expenses, revenues, wages, lots of those things. So could you talk a little bit about what are on those forms now?
Sure, I can take that one. So the federal cost reports, as you note, are very useful, and I'd say very widely used by policymakers for the problem of assessing whether or not, say, a particular regulation would be feasible, financially feasible, whether or not the industry can afford to adjust. And the federal cost reports do collect some related party information. We by and large don't make use of this data in our study, right? We use the corresponding Medicaid cost reports from Illinois. With the chief reason that we have this kind of threat of audit, which we think generally raises the fidelity of the data. But the federal cost report data do have both related party transactions and reported related party costs contained in the federal data. the concern we have with using these data is, trying to take these related party amounts seriously. We kind of run into the problems that Ashvin pointed out earlier, which is that if the nursing home's own costs aren't being audited, certainly the related party costs are not being audited, and so we do hesitate to use the related parties stated costs in the federal data. But of course, it does provide, kind of a jumping off point, you might say, in terms of thinking about reform, right? What can policymakers do in response to these findings? And the way we look at it is that, look, the infrastructure is already there, right? You have the forms in place. You're already asking facilities to submit them. Why don't we try to improve this, right? Why don't we try to, make this data higher quality? And, we think the best way of doing that is, as Ashvin said, just introduce the threat of audit, right? The reason the federal cost report data are not so widely used in academia, at least, is that they're not used for anything, right? Federally, right? The policymakers don't actually use them for anything. So as a result, there's lots of information in there that isn't very high quality. So, raising that, raising the quality of that data, we think is a very cost-effective policy that the government could try to pursue.
Great, thank you. One thing to point out too is CMS has the regulatory authority to require these related parties to open their books. If you look in the Medicare payment manual, and it's in the document that that's on the first slide, it explicitly states that these costs need to be reasonable and prudent. And what that means is that this is what you would have paid if you went out on the market and paid for these things. And you need to demonstrate that to us if we request it. And I think all of us know that that never happens. So anyway, let's move on. Are you seeing this related parties only in the for-profit industry? Do you see it in nonprofits?
We see it in both. And in fact, the main results that we've shown you, we can do separately by for-profits only or not-for-profits only. The key thing is that it's much more common for for-profit nursing homes than it is for not-for-profit nursing homes. So it does happen with not-for-profits, but far fewer. And if we tried to estimate it just for not-for-profits, we'd get much less precise understandings of exactly how much is exactly the size and scale. But it's there, it's happening, it's just rare comparatively. It happens with lots of the for-profit facilities.
Yeah, so there are two things working in the same direction. There are both just more for-profit facilities overall, and then among for-profit facilities, the take-up of related parties is much higher. So what that means is that for nonprofits, we're dealing with a smaller sample size, both because there are fewer facilities and also they're just less likely to engage in this behavior. But among the ones that do engage in this behavior, we do find broadly similar results.
Great, thank you. And so talking a little bit more about how this could be fixed with the increased disclosure and the possibility of audits, these couldn't there be put in place? Somebody mentioned AI, for instance, in the chat. I mean, not all of this would need to be done manually by a CPA. Could CMS use some sort of program to identify outliers, or you would know better, you're the economist, but is there a way other than just having a CPA pull a random amount of cost reports?
Yeah, absolutely. I think there was a great comment in the Q&A where somebody asked, could we use some of these fancy new artificial intelligence methods to look through all of the cost reports and identify suspicious content or suspicious values? And I think that's a great idea. I would say, like, you wouldn't even need to go that far. Like, there is a lot of, like, an Excel spreadsheet, a high school student with an Excel spreadsheet could identify many, many, many instances of, like, obviously incorrect values. I think in our paper, we point out, like, there are cases where nursing homes claim to have lost $100 million or made $6 billion in profit. And, like, those are just way outside the range of reason. And so if you even just start there and start flagging obviously wrong stuff, and then maybe look for related party transactions where the dollar amounts are really high and pick the largest cases there, or like you wouldn't I think even really, really simple methods would have huge, huge gains. That's the beauty of auditing, is that there's a long history of audits for things like income tax returns, where they're exceedingly rare, where in actuality, almost none of us, I bet probably odds are almost nobody on this call will get audited for their income tax returns they filed this week. And I think almost everyone in this call will be pretty darn close to truthful in what they submit.
Right. Yeah, Dr. Olenski?
Yeah, I just wanted to add on to that, one of the things we find is that nursing homes are really transacting most of their related party dollars with management and real estate. So off the bat, right, we're saying, hey, here are two areas that you could look at. And even if you wanted to just look at real estate, this is something that is typically very well documented, both when a transaction occurs, when you have a facility selling their building, as well as the imputing fair market rents is something the government does all the time for all sorts of purposes. This is something that we definitely could be doing in this setting, and we just aren't.
Great, thank you. Yeah, I can attest that working with these Medicare cost reports, decimal points can be that they had billions in revenues. It's clear, and they've been sitting there for years. It's clear nobody's even looked at them blank. Ernie Tosh, who's another expert in this, will say he finds blank ones, which lets you know that, I mean, if you can't catch a blank one, it's clear that you're that you're not doing a good job. So just to go back to the numbers, were these the numbers that you estimated? There's a question in the Q&A. Were these only management and real estate costs, or were they all related party transactions included in those hidden profits?
So the hidden profits include more than just real estate and management. So we find that the only other categories where there's any meaningful related party behavior at all is in therapy and in ancillary services, which is primarily pharmacy. But there it is actually a relatively small share of therapy spending goes to a related party. So if we wanted to exclude these other categories entirely, we would actually find very similar estimates for the total amount of hidden profits. But in particular, we do account for the other areas as well.
I was looking at a cost report 2 weeks ago when there was a related party transaction for a copier lease for $60,000 for 1 year. Just wild stuff.
Yeah.
I won't name the nursing home, but you could open one of the top few nursing homes in Illinois, and you'll find all sorts of comical stuff, like the owners listing their spouses as dietary consultants, and at some point someone's just got to write a paper with all the comical examples that are that exist in these.
And I think we'd be remiss, and they talked a little bit about it, the private equity. And over the past few years, private equity is being rightly demonized as kind of a destroyer of worlds. Wherever it goes, it sucks out all the money and leaves a trail of just broken businesses and unfortunately harmed residents. This isn't something that private equity created, this related party transaction, is it?
No, and I'll say I do some work on private equity. I'm actually I wouldn't say I'm super positive on private equity, but I'm probably less negative than most people. I will. What my work ends up showing is that private equity basically does exactly what you would train an MBA or a Econ 101 student to do, which is that they're very responsive to the incentives. And so in a lot of contexts where there isn't good regulatory oversight or it's not easy for consumers to discern quality, then that's going to be really bad. That means the Econ 101 incentive is to provide lower quality care. In some other contexts where quality is easy to discern, where there are a lot of options for consumers with competitors, then private equity might end up actually being a good thing in those specific contexts. Now, to the specific question around private equity and its relationship with related party transactions, we don't look at that specifically in our study because it's actually fairly difficult to identify who exactly is owned by private equity at any given snapshot in time. With that being said, I would say the best place to look for a little bit of evidence on this is, I believe, Atul Gupta, Abhinav Gupta, Sabrina Howell, and Konstantin Yannelis have a lovely paper that's forthcoming now that I'm sure if you have read anything on private equity and nursing homes, you probably heard or seen this paper, where buried deep in their appendix, I believe what they end up showing is that magically when private equity buys up a nursing home, suddenly you see the management fees that this nursing home pays going way up.
Right.
And so while I don't have a ton of data on this, I strongly suspect that your hypothesis is correct, right? If there is a strong incentive in the industry to hide your profits through related party transactions, you better bet that the sort of Harvard MBA types that are running these private equity companies recognize that and are going to be responsive to that incentive.
I would say it's blood in the water, right? And they sniff it, and you may not say that, but that's what I say. I did it.
They're smart and extremely responsive to incentives. So if we want to regulate in the healthcare industry, we got to get the incentives right. And I think here, this is very clearly a case where the incentives are wrong, where you have a strong incentive to do this hiding of profit.
I looked at some homes in Tennessee. I did something similar to you. I looked at some homes purchased by Porto Piccolo, an infamous private equity group. I looked at what the related parties' costs were the year before they bought them and the year after, and it went up by a factor of 7 or 8. Management fees went up from 400,000 to 800,000, and I mean, and this is millions of dollars across 8 homes. So before we go, I just wanted to kind of wrap in. Did either of you want to say anything else? I wanted to kind of wrap it in a bow and say thank you, but were there any other questions that you wanted to answer or say?
So just one thing that I don't think we hit on, but I think we should emphasize is that we find pretty considerable hidden profits on average, right? The $300,000 per facility among the firms that report any hidden profits. But we do also find that about a third-ish of facilities report little to no related party transactions, or our estimates of the hidden profits are close to zero. So while we absolutely think this behavior is widespread, I think the wrong takeaway would be that every single nursing home has $300,000 sitting in the bank each year. So that is the one caveat I want to throw out there.
Agreed. Some have more, some have less.
Mm-hmm.
The key thing to keep in mind in general, if you're reading any research study, is that typically what we're showing you is the average. And there's always a lot of variation around that average. The only thing I want to add is I just want to say, thank you to everyone who's on this session, and as well as to everyone in the audience. We really appreciate all the really, really excellent questions in the Q&A. I tried to go through and answer as many as I could while I was talking or while Andrew was talking, but there were more amazing questions than we could get to. Please don't hesitate to reach out to either Andrew or I via email or Twitter. We think about nursing homes every day of our lives. We love to talk to other people who are thinking about nursing homes. And yeah, thanks so much. We really, really, really appreciate you guys taking the time. I know you're all extremely busy.
No, it's trust me, it's all of us who are grateful. We're really happy that you took a look at this important issue. All of us who advocate for better care for nursing home residents and other recipients of long-term supports and services have been screaming about related parties I wake up in the middle of the night yelling related party. So it's nice to have two economists who we're not coming to this from an advocacy standpoint, but looking at data, reaffirming what we're seeing. And we are calling on CMS, and we've repeatedly called on CMS to to look at the data and to implement some kind of auditing system, and also increase really the information that these related party companies need to disclose. We have one more minute. I wanted to ask one more question, and this might be outside of it, but a question in the Q&A from Tony Chicotel. Did you observe any other profit hiding tricks, such as no interest loans to owners, or assets called negative liabilities, or related party insurance policies where the premiums cost more than the policy benefit? Anything? This is a very leading question, which I like, but I didn't know if you saw any of that in your analysis.
So we didn't look at any of those specifically, just because, you know, we really wanted to focus on the part of this that we have good visibility on, and that we thought was driving sort of the majority of this. We're sure that there's more going on in all sorts of different areas, but we think that the case is strongest here, right? So part of what we think about ourselves as doing is, like, I don't want to say like we're like the prosecutor here, but basically, you know, you have a much easier time making the case where the data is best. I would love, and I would hope that other researchers and advocates, if you guys can figure out how to identify where you think that's happening, we would love to hear and see more, because we've heard similar accusations, and it's more than plausible. The only thing that we don't talk quite as much about in our research, that we talked actually quite a little bit about today, is it's not just the rent that you're paying, it's also potentially these sales of assets related.
Yeah.
And I would say that probably, and this was on the takeaway slide, anytime you have a large value asset that's being moved from the books of one entity to another entity, that may be a scenario where you really want to double down on the scrutiny, because that's another place where all in one transaction, you can move a ton of value off books.
Right. And just for folks to remember, these are taxpayer dollars, right? Medicare and Medicaid dollars that these are that are going to. So we're funding this to to a large extent. And also, just to bring it back to residents and workers, when this money is taken away from facilities, it's taken out of the pockets of workers, and workers work for $14 or $15 an hour, and you have huge turnover of 50% a year, and ultimately it's taken away from residents. This is almost like medical information. I mean, after seeing this webinar, you want to know whether the nursing home you're going to go in or your mother is in is using related party transactions. And this is the type of public information that needs to be presented to the public, so that they can make informed decisions. So again, we're at the hour. Thank you so much. This was a informative and wonderful webinar. Thanks to everyone who attended. Next slide, please, Libby. Here's all our information. You're going to be able to see this recording. You go to theconsumervoice.org. You can see the recording, and you can also download the slides. And thanks again, Dr. Olenski and Dr. Gandhi, and thanks all for coming.
Thank you.